Hey everyone, Professor Davis here, and we are going to be diving into the respiratory system here in medical terminology. So before we get started, let's kind of do an overview of the structures of the respiratory system. So we do see structurally we can have a division based on these structures, and the division happens right here at the larynx. The larynx is known as your voice box, and so anything at your voice box or above is going to be part of the upper respiratory system. So this of course includes your nose. It also includes your nasal cavity as well as your throat, which is your pharynx. Your pharynx is divided into several parts. You have the nasopharynx, which is by the nose, the oral pharynx, which is the connection with the mouth, and the laryngeal pharynx, which is going to be connected to the larynx. Under the larynx, you have the trachea, and this begins your lower respiratory tract. The trachea is going to branch into the bronchi. The bronchi are going to then branch into smaller tubes called bronchioles. These bronchioles are going to end at these sac-like structures called the alveoli. These are found deep in the lungs, and this is where the capillaries of the blood are located, where gas exchange can actually happen. So oxygen goes into the blood and carbon dioxide comes out of the blood so that you can breathe carbon dioxide out. Now, your respiratory system does not just help with this gas exchange. It also is going to help with regulating the pH balance in your blood. Carbon dioxide travels as an acid, and so your breathing and how quickly you get the carbon dioxide out is going to affect the pH. We also see that air is going to be pushed across your vocal cords in order for you to create sound. So when somebody has like laryngitis, where they have an issue with the inflammation there, they can't talk and it causes them to be real hoarse. We also see it's going to help with smell. As you draw air in, it brings up the odorants up into the nose and allows you to smell. If that's all clogged up when you have a cold, you're not able to smell as well. And so we see that this is the main structure of the respiratory system. So let's talk about some of the root words that you see for the upper respiratory system. These are going to be things like naso or rhino. These are going to deal with your nose. Epiglottal is talking about the epiglottis, which is a special structure that when you swallow, it's a flap that covers the trachea so that when food goes down, it goes down the esophagus and not into your respiratory system when you're eating. We also see you have laryngeal, which is the larynx area, and then the pharyngeal, which is the pharynx or throat area. So again, you can put some of these words together like nasopharyngeal, talking about the area where the nose and the throat come together. All right, and so this is just giving some examples of the upper respiratory tract combining forms. Of course, there are more, but these are just some. All right, so for the lower respiratory tract, we have apico, which means apex, so like the point. We have bronchiole, which is going to talk about the bronchioles, the tiny little tubes in the lungs. We then have pherno here, which is talking about the diaphragm. You have pneumon, pulm, and pulmon for dealing with the lung itself. And then you have thoraco, which is talking about the chest or thoracic cavity, which is your chest cavity. So again, these are not all of them, but these are just some that can be used for the lower respiratory tract. All right, so let's do some respiratory function word parts that are going to come into play. So some of the diseases and disorders that we are about to discuss are a result of not getting enough oxygen to the body or having too much carbon dioxide. And so that's where a lot of these may come from. So you may need to know some word parts that deal with the gases. So this is like with oxygen or carbon dioxide. And so that's why these are kind of listed here. So oxy is going to be with oxygen. Capnia is talking about carbon dioxide. All right, and so this is just another little part there. Another thing, remember we talked about the respiratory system helps you with speech because as the air goes across your vocal cords, they vibrate, allowing you to talk. So we will see too that the ability to speak is another function that the respiratory system does, and we have again some words that deal with that, with the speech and the voice. So you have phasio, which is the speech, phono, which is the voice. Now, of course, when we're talking about with breathing, we do see that you have different types of breathing that can take place. And so you have pnea, which is talking about breathing itself. And we can add words to that when we're talking about pnea. There's also spiro that could be on here, and spiro is the combining form used for respire or respiratory. Inspire, meaning taking air in or sending air out. And so that's part of that. Going back to the penia for the breathing, you could put U in front of it, which means like true or normal. And so that would be like eupenia, which is the normal breathing. However, if you put dis in front of it, you could have dyspnea, which is difficulty breathing. Now, substances such as mucus or blood may need to be spat out of the lungs. We got to get it out of there. So like coughing it up and then spitting it out. And so this is where spitting may come into play. Hemoptysis is where we're spitting up blood, because hemato is blood and ptysis is the spitting. And so again, we can put these together. And so the book does go into more detail with some of these with respiratory function, but we're going to see that we can add some of these combining words from upper respiratory or lower respiratory, along with also these functional words. So let's go back to the upper respiratory tract real quick, where we're talking about our nose and the nasal cavity. There's also some structures in here called the paranasal sinuses. These sinuses are going to be on each side. So you have some here in the maxillary region. You also have some up here in the frontal bone area. There's some deeper in the ethmoid, but those are going to be pockets where air can go through. If those get clogged up and you have sinus infections or sinus clogs, that causes you to feel like you're not speaking properly, and it causes you to sound muffled. It changes how your voice sounds as air would move through those kind of spaces. You also have the pharynx, which is the throat, and the larynx. And so the abbreviation for the upper respiratory tract is URT. Okay, so upper respiratory tract. And we do see that your nose, if we go back to the nose, it is going to be actually divided by a septum. This is going to divide it into a right and left side, and this is where you get your nostrils. And we also see that you can use nares as the medical term for nostrils. Naris is a singular version. We also see that we have things like retronasal, so behind the nose, supranasal, which is above, or endonasal, which is inside. You also have nasolacrimal duct. And so if we break this down, naso tells you nose, but lacrimal is going to be pertaining to tears. And so you have tears that form in your eyes, and in the corner of your eyes, you have a little pinhole called the puncta that allows these tears to drain down into your nose through a duct called the nasolacrimal duct. We also see then we can move on into the mouth area, and that's known as the oral. The top part of your mouth is the palate. Palatine is the bone that's there. You also have your uvula that's hanging at the back of your throat. So that is more of the mouth form. So oro is going to be the combining word that you would use more with that. We also see that olfaction is the ability to smell. And so olfaction is being able to smell. So olfactory is the adjective used for the sense of smell. And so the olfactory nerve is going to connect up here in the nose, allowing you to be able to smell. When we get into the throat area, we've already covered this a little bit. You have three sections. You have the nasopharynx, which is up by the nose. It's where the nose connects to the throat. You have the oropharynx, which is where the mouth connects to the throat. The laryngeal pharynx, which is going to be where the larynx and throat come together. You also can see where there would be like pharyngeal, laryngeal. Those are going to be the adjective forms when we're talking about those areas in the upper respiratory system. We also have the glottis, which we have the epiglottis, which is going to be pertaining again to that area and where that structure would cover. It's above, it's next to the glottis area, which is the voice box, and it covers up the trachea to allow food to go down the esophagus. We also have the vocal cords in this area, and they vibrate as air comes across. And we have the epiglottids or epiglottitis is where that structure, the epiglottis, gets inflamed with inflammation. And so these terms are going to be terms that you would see more with the upper respiratory tract. All right, so now let's look at the lower respiratory tract. So remember, the lower respiratory tract is going to deal with the trachea and the lungs and all the structures inside of the lungs. This can also be abbreviated as LRT for lower respiratory tract. So if we're looking here, the trachea is also known as the windpipe, and it goes down into the lungs. So we can have tracheal can be used here, or endotracheal if we're talking about some terms that go with the trachea itself. We then have the lungs, and the lungs kind of are triangles. triangle shape. So the top actually is going to be the apex area, whereas the base is on the lower portion of the lungs. We also have the hilum, which is going to be the area in the lungs where the blood vessels come into the lungs, at least the large blood vessels. We have the mediastinum, which is the very middle portion of the thoracic cavity or the chest. It's right between the lungs where the heart is actually located. We do see that inside these lungs, you have the primary bronchi, which is where the trachea branches, and one bronchi goes to your left lung and one goes to your right lung. We see that those then branch again into secondary bronchi, then tertiary, and finally into these little bitty structures called the bronchioles. These tubes are all there to conduct air from what you breathe in down into the deep part of the lungs, where gas exchange can occur. This gas exchange does occur at the velar ducts or at the alveoli structures. And these are the sacs that are like little balloons that blow up when you breathe in, and they're going to come in close contact with those blood capillaries to allow for the exchange of blood. So when we're talking about this, we have bronchial, alveolar, we've got bronchioalveolar if you're talking about where the bronchi and alveoli come together. You have the apex we talked about with apical, the base. We also have pleura, which is talking about the lungs itself. That's a covering that we talk about with the visceral. Pleura is right up against the lungs, whereas the parietal pleura is against the thoracic cavity. And there's fluid in between. That structure is really important for the lungs because it helps reduce friction as they expand and retract with each breath that you breathe. We do see that things could be extrapleural, which means outside the lungs. When we talk about the lungs themselves, we could say that we're talking about pulmonary or pulmonic with the lung structure. Diaphragm is that muscle that's going to help with breathing. So if you're doing diaphragmic breathing, you're doing this really deep breathing and using your diaphragm to draw that air in. Okay, and so these are all terms again that you're going to see with the lower respiratory tract. All right, so diagnostic tests and procedures that are seen with the respiratory system. We do see that a lot of times we will use sounds when we're looking at diagnostic tests. So abnormal sounds include different things with rattling in the lungs or wheezing that we might hear. And so whenever they tell you and they get their stethoscope out and they put it on you and they say, okay, take a deep breath in, they're listening for these different types of sounds that might be present. We have like raunchy, which is a continuous rumbling sound that clears when you cough. You have wheezing, that is more like a squeak that takes place. If you've ever heard anyone with asthma trying to exhale, you kind of hear this squeakiness that happens with that. We also have crackles, which are a discontinuous bubbling noise during inspiration, like when you breathe in, and it's not cleared with coughing like we saw with the first. We see that we can have friction of a rub that is dry, grating sound that can occur in the pleural area. This could indicate things like lung disease. So these are just some of the examples of what we would end up hearing. We can also hear stridor. Stridor means an abnormally high-pitched musical sound. This is normally caused by an obstruction of the trachea or the larynx. So when like someone is choking and there's an obstruction in there, it would sound more like what we would call a stridor. And so these are just examples of when we're listening to be able to help with diagnosing what's going on with the lungs. We also see that some diagnostic tests could be where we take arterial blood gases. Arterial blood gases are going to check to see how much oxygen and carbon dioxide are present in the blood at any given point. We also see that they will test the pH levels. This is important to make sure that the actual exchange of oxygen and carbon dioxide is happening like it should. Okay, and so it's really important that we look at that. We can also take cultures of the phlegm or sputum that somebody coughs up. This is going to be important in helping us diagnose if there are bacterial infections or fungal infections that are taking place. So we're able to do that. We can also do a bronchioscopy where we take and put a camera down into the bronchi and take a little bit closer look. And we can also do a pulmonary function test. Pulmonary function tests are to see how well the lungs are actually going to be able to expand and have the capacity for the air that they should, as well as how well do they push the air out. All right, and so it's just testing the different types of breathing. And so you may just be doing just normal breaths, which we call tidal volume, where they just breathe normally, say take a breath in, take a breath out, no big deal. But then they might tell you to force the air in, so you, and then you breathe out really forcefully. That's going to look at some different capacities. But the whole thing looks at your what we call your total lung capacity. And so they can do a pulmonary function test. So we can also see here that there is some disordered breathing that we can have terms for that we want to take a look at. And some examples that of some diseases and some things that can happen if breathing is affected and your breathing is not occurring like it should. Could be things like acidosis, acidemia, or alkemia, or things like alkalosis. These are all pertaining to how acidic or basic the blood is. So when you see acidio, it's talking about the acid, whereas alkalo is talking about the base side. And so your blood likes to stay between the pH of 7.35 and 7.45. If it goes below that, it causes you to have acidosis. And if it goes above that, you have alkalosis. In both cases, if this happens for an extended period of time, it can affect the rest of the health of the individual. And so these are some terms that deal with that kind of idea of acid and base. We also have asphyxia or asphyxiation. This is going to be caused by insufficient intake of oxygen. It can result in extrinsic circumstances, like if somebody was drowning, or if they had a crushing injury of the chest, or if they inhaled too much carbon monoxide. This could all be part of that external. There could also be an internal issue, such as a hemorrhage in the lungs, foreign bodies that get inside the lungs, or even diseases of the airways themselves could cause that. We could also have Cheyne-Stokes respiration, or CSR. This is alternating periods of apnea, where you kind of stop breathing, and deep, rapid breathing, and this occurs more frequently during sleep. And so this would be something like a sleep apnea test would test for. And then we also have hyperventilation, where you are breathing too quickly. One of the main treatments for hyperventilation, you're breathing too fast, is to breathe into a brown paper bag. And it's not just to make you look weird or look odd that you're doing it. There's a purpose. When you're breathing out super fast, it actually causes your blood to go into an alkalosis state, and that's not good. So when you breathe into the bag, you're breathing carbon dioxide into the bag, and then you're breathing it right back in. So this starts to bring the pH of your blood back down, and so it helps because remember, carbon dioxide travels as a acid in the blood. We also, again, penia deals with breathing. So you can have hyperpenia, increased breathing, hypo, decreased. Bradypenia means slow. Tachy is, again, fast. You could also have orthopenia, which means that you have difficulty breathing unless you're sitting up straight. Dyspnea, of course, is going to be difficulty breathing. And eupnea is normal breathing. Again, this is just some of the examples located in your textbook, but it goes over some of the disorders of breathing. So with us upper respiratory tract abnormalities, these are going to be things that obviously can cause issues and problems with your upper respiratory tract. You could, of course, get like a type of coronavirus. One in particular is known as the severe acute respiratory syndrome, or SARS. You also have COVID, which is part of this as well. These are going to affect the upper respiratory system to begin with, nose, throat first. You could also have coryza, which is an acute rhinitis, so inflammation of the nose, but it's also going to be due to increased mucus, like lots of discharge of mucus that is present. Rhinorrhea is going to be extreme, like kind of nosebleed that you have going on, or hemorrhaging that's occurring. We can have croup, diphtheria, and pertussis. These are all going to be diseases that can get a little bit deeper into the chest. But this is known as like whooping cough is what we would call pertussis. But these are all respiratory diseases with that. And then you can also have a nasal polyp where you have these little growths that are happening in the nose. Now, when we're looking at like SARS or croup, diphtheria, and pertussis, some of these are actually reportable to the CDC, whereas others don't have to be. And so sometimes things need to be reported in order for us to do kind of an epidemiological study. Now, remember, if we add itis to the end of any word, it means inflammation. So epiglottitis means that the epiglottis is inflamed. Laryngitis is the larynx. Palatinitis is like the top of your mouth. Pharyngitis is the throat. Rhinitis is the nose. Sinusitis are your sinuses. And then tonsillitis are the tonsils. But remember, itis means inflammation. All right, so again, some respiratory pathology that's located in here. So anthrax is talking about coal here. This is used a lot of times with anthracosis, which is a respiratory disease caused by prolonged exposure to coal dust. So people who work in coal mines, and they might develop something like this. Atoll means like imperfect or incomplete, and this is used for like atelectasis, which is an incomplete expansion of the lung or part of the lung. Coney is for dust, so you could have pneumoconiosis, which is a disease of the lung caused by chronic inflammation from dust. So before we actually get an embolus, a lot of times we have what we call a thrombus, which is an internal blood clot. If it breaks off and then travels through the blood, then you have what we call an embolus. And so sometimes you can develop what we call a pulmonary embolus, and this is where the blood clot gets lodged into the lungs themselves. We also have fibro, which is fiber or fibrous. This is used with like pulmonary fibrosis. This refers to a lot of times the formation of scar tissue that happens in the lungs. We can also see meta, which is a change. This is going to be something like a part of metabolism, or cellular metabolism. It relies on respiration. This is going to be a change of energy that takes place. Asphyxiation is a process, so asphyxiation is going to be a not being able to breathe, the process of not breathing. All right. Overinflation is going to be where you are inflating the lungs too much. We also have pneumonia again, which is breathing. We have ptosis, which is a prolapse. So with pneumonia, we could see that we had lots of different ones like apnea, orthopnea, dyspnea, eupnea. Ptosis, we also could see that there's a prolapse in the diaphragm. So this would be like phrenoptosis, where we see that there's a diaphragm issue. I've already talked about ptosis, which is spitting. And then we have stenosis, which is a part of the term that's talking about narrowing. And so you can have tracheal stenosis, where the trachea is narrowing, or the hole that is getting smaller in that trachea. And so these are some of the terms we could use for respiratory pathology. Now, for the lower respiratory anomalies that could take place, you could have aplasia, which is the absence of formation or development, which is incomplete of the lung itself. So aplasia of the lung could be part of that. You could also have asthma. This is characterized by a recurring episode where you've got all this like kind of wheezing and difficulty breathing, like dyspnea. It's normally due to constriction of the bronchi inside of the lungs, due to maybe some sort of irritant, or it could be due to overexertion. So there's a lot of different things that could happen with that. We could also see pleural effusion. This is a collection of non-purulent fluid that's happening in the pleural cavity. So this means not pus. When we talk about non-purulent, if a pleural effusion contains pus, it's not called that anymore. It's called a pyothorax or an empyema. We do see that if it's blood, it's also something else as well. You can see that we have some of these types of diseases that can be present here, like you could get a pneumococcal pneumonia. This is a specific type of pneumonia. There is a vaccine that's available for pneumococcal pneumonia, and it's recommended for people who are older than 65. So this obviously is going to affect people who have more immunodeficiency as they age, and so that's why that would be present. There's also going to be respiratory distress syndrome, or RDS. This is an acute lung disease of the newborn. This occurs often in premature babies because they're having to try to breathe, to work so hard on breathing. We also can see congestive heart failure can affect the lungs because the heart is not able to pump properly. Fluid can start building up in the lungs and also in the tissues, and so this creates problems for the lungs as well. COPD is a result of insufficient expiratory effort, and so the rate of respiration increases due to this. Breathing becomes a lot more shallow, and you see that a lot more air is going to be trapped in the lungs with people who have COPD. Another type of infection is going to be tuberculosis. This infection is a chronic infection. It commonly affects the lungs, and tuberculosis can be super contagious, and it does still kill lots of people every year. Now, a lot of times when we're looking at a lot of these diseases, if you've got an active infection in the lungs, you have fluid buildup, and this is known as pulmonary edema. Another disease that is going to affect the lungs specifically, as well as digestion, is cystic fibrosis. This is an inherited condition or disorder, and it ultimately affects the exocrine glands, specifically the ones in the lungs, the pancreas, and your sweat glands. And it actually causes them to not function properly. And so because of this, it forms a very thick mucus. The mucus is a lot thicker than normal, and it actually starts to clog up the bronchioles. So it causes major issues. The main way that we can actually diagnose cystic fibrosis is through a sweat test. The child's sweat will be super salty because of this heavy mucus that happens. Pneumoconiosis, this one is the one where you have the lung damage due to chronic inhalation of dust. This is usually mineral dust that's the problem. This is like an occupational or environmental hazard. But we also see that it could be due to other types of dust, like asbestos is where you breathe in the asbestos, and it causes you to develop a type of cancer called mesothelioma. And so these are just some examples where you specifically see that they are taking in something specific. So the anthracosis was talking about the coal. Silicosis is talking about silica dust. And this is going to be from sands, quartz, and things like that. And so those are just some more specific examples of what they were actually breathing in the dust. All right, so some surgical and therapeutic interventions that deal with the respiratory system. We have the Heimlich maneuver. The Heimlich maneuver is going to be what a rescuer does. It grasps the belly, pushes upward to get out anything that is blocking the airway if someone is choking. All right, and so this would be what we would use for the Heimlich. You can use an incentive spirometer. This is going to be a small apparatus that provides visual feedback about how much air you're actually taking in. A lot of times they'll use these when somebody's had surgery and they want you to like breathe into it, and you can see how much, and you want to keep the ball in a certain area on it. It's just a little machine, and it again is just for you to be able to visualize how well you are breathing. We also have a pneumoectomy or a pulmonary lobectomy. A pneumoectomy is going to be either a partial or complete, and we usually are going to be treating lung cancer with this. So it's a removal of the lung, which requires an open surgery that will provide full access to the structures in the chest. But a lobectomy is the excision of a single lobe of the lung. So your lungs have some lobes to them, and so a lobectomy is we're just taking one part of the lung. We also see that we could do a tracheotomy. Okay, when we do a tracheotomy, this is going to be where something is swelling up here or blocking up here where air can't get in, and so we can't just put in a tube in order to help with breathing for a ventilator. And so they have to go through here, which is right below the larynx where the trachea begins, and that's where they go through. And you've seen in the movies where they talk about how they need to do this, and they're like, do you have a knife and a pin? And they cut it and they put the pin in it and they breathe through it. That is similar to what you're doing, but obviously in the hospital it would be more sanitary and you'd actually have the proper tools. A thoracentesis is a surgical puncture of the chest wall in pleural space with a needle to aspire fluid out of it. And we also see we have the pharmaceuticals that can come into play, so medications. So antihistamines block histamine receptors, and so this deals a lot of times with allergies, so this would deal with asthma here in the respiratory system. Antitrusives are going to express the cough reflex, so they're going to cause you to have that, because you're coughing too much, it's going to help suppress that. Bronchodilators are going to dilate the bronchi. These are really important when we talk about inhalers or in breathing treatments. Decongestants are going to reduce the congestion and swelling of the mucous membranes. Expectorants are going to promote the expulsion of mucus from the respiratory system to get it out of there. Mucolytics are going to break up thick mucus in the respiratory tract. And so again, these are going to be kind of medications may fall into these categories based on what they do to help with breaking up mucus or getting things out of there, dilating. It could be any of these. All right, last but not least, we do have some abbreviations in here. You do have ABG. This is arterial blood gas. CPAP is continuous positive airway pressure. This is used a lot of times for sleep apnea. You can see ECMO, which is ECMO. That's going to be a extracorporeal membrane oxygenation. We also have PFT, which is pulmonary function test. SOB here is shortness of breath. So it's shortness of breath. We also see that you can have some diseases or some things that we can give actual abbreviations to. So adult respiratory distress syndrome is known as ARDS, ARDS. We also have chronic obstructive lung disease known as COLD, COLD, all capitalized. Respiratory distress syndrome is RDS, and then SIDS is sudden infant death syndrome, so SIDS. And so these are just some abbreviations that deal with the actual respiratory system. I know we went through these pretty quick, but I hope this gives you a little introduction to the chapter over the respiratory system. If you have any questions, please let me know.